So X waiver, it sounds very like really cool, doesn't it? I have an X waiver. So it is a waiver that has allowed prescribers of controlled substances to prescribe a particular drug, buprenorphine, in the management of opioid use disorder. And it really is an X. So when you apply for DEA registration and you get the X waiver, you get another DEA certificate that actually has an X in the number. So the X waiver, well, it started in the year 2000. The law that initiated the X waiver was called the DEA 2000, or the Drug Addiction Treatment Act of 2000, passed coincidentally in 2000. So for 22 years, I guess 23 years, prescribers of buprenorphine needed to have an X waiver, which had a particular requirement for either certification by an addiction medicine board or particular specific continuing education. But in recognition of the overwhelming incidence of the opioid crisis and the need for opioid or for prescribers of buprenorphine to manage opioid use disorder, in 2022, Congress passed the Consolidated Appropriations Act of 2023. And so effective January 1st, or sometime in January of this year, it was eliminated. No more requirement for an X waiver, no more requirement for the very particular continuing education hours. For instance, nurse practitioners needed to complete 24 hours of very specific education to be eligible for the X waiver. And as of January, the law just erased it. So now we have a new DEA requirement effective June 27th, as you mentioned, and it goes far beyond just prescribing for opioid use disorder. Now, because there is no more X waiver, there is no more continuing education specific to opioid use disorder prescribing, now the DEA has a regulation that every prescriber of controlled substances, everyone who has a DEA registration, whether it's your initial application or a renewal application, as of that date, every prescriber will have to attest that they have completed a very prescribed aspect of continuing education or initial education, and 8 hours of very specific education. Again, an 8-hour program that includes information specific to the assessment and treatment of opioid use disorder and or other substance use disorders. So who the requirement applies to? Everyone who has a DEA registration. This is the interesting disconnect here. The X waiver, the DEA 2000 requirement, that was just for people that were going to do substance use disorder management. So a comparatively small fraction of DEA registrants. But now, because that's gone, every single person who prescribes controlled substances and has a DEA registration, all nurse practitioners, all physicians, physician's assistants, dentists. The only one it specifically excludes, and I'm not sure why, the law specifically excludes veterinarians who practice exclusively as a veterinarian. They too sometimes prescribe opioids and controlled substances. They're specifically excluded from this requirement. I don't know why, but like I said, everyone else, so every single prescriber who holds DEA registration, that's who it applies to. It's a huge population. Is anyone exempt from the requirement? Well, no one's exempt from it. There are people that already meet it and don't have to go back and do any other additional specific continuing education. And that would be, well, people who held an X waiver. So people like me who had the X waiver before the law changed, that meets the requirement. So like when I renew my DEA registration next time and I have to attest that I have met the training requirement, I can just check off yes because I'd already completed the requirement for the X waiver. I also believe that physicians who are certified in addiction medicine or addiction psychiatry by the appropriate medical board are exempt from this training. There is not an analogous allowance for APRNs and physician assistants. So is it one time, or do we have to do it every time we renew? That's a good question, because so many times CE requirements are necessary every time you renew a registration, but that's not the case with this one, at least according to the most recent letter that was distributed by the DEA. It is a one-time requirement. Can you split the time or complete it all in one 8-hour program? Either way, you can complete it all at once, or you can split the time. You can do a few hours in one, and a few hours in another program. The only thing that I really would advise people is, however you meet the requirement, number one, look at the DEA letter and make sure you understand what it is, because the requirement isn't just about controlled substance prescribing. It includes opioid use disorder or other substance use disorder. And use disorder includes things like risk assessment, the utilization of objective tools for risk assessment, like the SOAP-R, the opioid risk tool. I mean, there's very specific ways to go about screening, and then management strategies. So there's a specific material that has to be there. And the other thing that I would advise people, and this really is just a piece of personal advice from experience, if you've completed it in bits and pieces, or you're renewing your DEA registration and you think, oh, I did this before, I had this class, a couple years ago, I can check it off. Just make sure that you can validate the fact that you have completed this requirement. You may never have to prove it, or you may have to prove it, but it's just a really good idea to make sure that you have your CE certificate. The certificate is clear on what the content was, that the number of hours were met in total, whether it's one certificate or 4, and that the date is on it. Can prescribers receive credit for training they've already done, as long as it really does meet the requirement of this regulation, which, again, specific to not just opioid prescribing, but use disorder, assessment and management of use disorder. But yes, if you've taken it in the past and you have verification that you've taken it and it got the 8 hours, then yes, that can be used. What happens if you don't complete the requirement is you can't say that you did. So when you go to renew your DEA registration, and there's a box on the renewal, or there will be a box on the renewal application that asks you very specifically if you have met the requirement. And if you haven't, you can't answer it and you can't renew your registration. And then you can no longer prescribe controlled substances of any sort. So it is important for people to realize this isn't just about prescribing for opioid use disorder. This is prescribing anything. If you don't meet this requirement, you can't renew your DEA registration, and you are therefore ineligible to prescribe any controlled substance. Where can you meet this requirement? Well, as a matter of fact, Colibri Healthcare, we have a course designed very specifically for this requirement. So it's available. I mean, you can pursue it on our website. It's available on demand.